The number of women dying during or shortly after pregnancy, after giving birth, has risen for the first time in a decade, as a new report shows alarming declines in patient safety. Really shocking statistics, this. We're going to speak to two women who've both got harrowing stories about their own personal maternity care. Former MP Theo Clark feared that she was going to die after undergoing a 2-hour surgery without general anaesthetic after giving birth. And Chloe Vowels Lovett's complaints of horrendous stabbing pains were dismissed by hospital staff before her baby, Esme, died at 38 weeks.
Two very powerful stories illustrating the problem coming up. We'll talk to them live next. Hi again, just gone 7:15 now. I don't know, childbirth. We seem to be going backwards. Damning new findings have revealed the number of newborn babies and mothers dying during pregnancy is going up for the first time in a decade.
It's strange, isn't it? Because we like to think we're getting better at this sort of thing.
Nope.
And it comes amid a report out today exposing an alarming decline in patient safety across the NHS, with maternity care one of the worst. Now, researchers at Imperial College London found a 52% rise in the number of women dying during or shortly after pregnancy in recent years, while rates of babies dying before they're a month old increased 15%.
Extraordinary. We're joined now by the former MP for Stafford, Theo Clark, who's launched a parliamentary inquiry into the nation's maternity care early this year after her own awful experience with birth trauma, and Chloe Vowels Lovett, who lost her daughter Esme at 38 weeks despite persistently complaining there was something wrong. She was getting stabbing pains during calls to hospital, but they just ignored you until the worst happened. Let's start with you. I mean, these stories that you've both got to tell are so traumatic, and yet they're so damn typical. What happened to you?
So I had a very long labour of nearly 40 hours being induced, ended up in emergency surgery after a postpartum hemorrhage post-delivery, and was actually awake on the operating table for nearly 2 hours. And to be honest, Richard, I really thought I was going to die. It was the most terrifying experience of my life.
No anaesthetic?
No general anaesthetic, because I'd already had an epidural.
How were people treating you around you at this point? Did you feel that they had the same sense of drama as you were feeling?
So I think for medical professionals, they're used to this as their day-to-day job. But for you as a new mum, having my first baby, it was really the first time I'd ever been in an emergency surgery in hospital.
Yeah.
And what really shocked me afterwards was the lack of aftercare. So I remember coming out of surgery, being with my daughter, and her screaming in the cot next to me and pressing the emergency button, asking for help. And this lady came in and she said to me, "Not my baby, not my problem," and just walked out and left me there. And I just don't think that's acceptable.
Was this a
We
nurse?
need to have a frank discussion. This was one of the NHS professionals on the ward.
Oh, my goodness me. Chloe, before we talk about... I'm bewildered by that. I mean, Chloe, what was your experience? Because you were trying to flag that you had an instinct something was going very wrong. How were you treated in that situation?
So towards the end of my pregnancy, I experienced the most horrendous stabbing pains. I was bedbound for weeks, and in the last 6 weeks, I made multiple attempts to try and get help. I was in and out of hospital. I made calls to triage, and my concerns were just constantly dismissed. And
what were people saying that you... Oh, it's just...
You're an overly worried first-time mum. Yes, sort of fobbing it off as any sort of, any easy excuses they could without looking into the real problem.
Any treatment at all? I presume it was paracetamol, aspirin?
So I was sent home with cocodamol once, and then when I phoned weeks later to express that I was still in the same pains and experiencing other symptoms, I was told to phone the GP to see if I could get some more cocodamol.
What actually then happened?
I ended up having a placenta abruption. And
Can you explain that in layman's terms?
So it's the placenta, breaking away from the baby, abrupting, and it has, there were numerous blood clots in my placenta. So essentially it stops working.
That's the baby's life support system.
Exactly.
Yeah.
Esme was absolutely fine, fully grown, nothing wrong with her. It was just that her placenta failed, but it was the hospital that failed.
So what happened then? What happened then?
So, in the last week, I made 2 phone calls where I tried to get my last bit of help. And both times I wasn't brought into the hospital. And it's since we've had a report written by the hospital themselves where they have listed the numerous occasions where they should have brought me in or they should have done something differently, should have done a scan, different things, you know, there were many different things that they could have done to
Chloe,
have a
you
different
must
outcome.
be feeling, I mean, grief, horror, desperate sadness, and also, I would have thought, some anger, really, at this.
Such anger.
Such
the
anger.
minute we found out she was no longer here and she'd passed, I screamed and said, I told you something was wrong.
Oh, my God.
I sat in hospital weeks before and I said, this baby is going to die. I had a gut feeling my baby was going to die and no one listened to me.
Why did they ignore you?
I just believe that they think, as they said, I was an overly worried first-time mum. They didn't think that my symptoms were real. They just thought I was overreacting, I think. And there wasn't... I almost don't think there was a desire to believe me.
Theo, this seems to be something that almost transcends what we're talking about here. You hear, for example, with sepsis, that patients aren't listened to. The patient says, I'm feeling awful, I'm feeling really bad. Well, have a paracetamol. They're dying of sepsis. It seems to be almost endemic at the moment in the way that patients aren't listened to.
I think that's absolutely right. And I'm so sorry to hear Chloe's story. I'm afraid it chimes with the over 1,000 families that wrote to me as an MP chairing the UK birth trauma inquiry in Parliament earlier this year. And I read incredibly harrowing testimonies of other families who sadly lost their babies, in many instances where the hospitals had covered it up, or there are examples of medical negligence. And I actually called our report Listen to Mums, because I think people like Chloe know what they need, and actually it's about implementing it.
Why is it getting worse?
So I think, firstly, we need to be prioritising funding. So we need to obviously have more staff on the wards. I could see myself as a mum. It was incredibly understaffed that night. We need to have more midwives. But also I think it's about policy. So today's report is very shocking, but I'm afraid it's very similar to the report that I published in May, the CQC stats out a few months ago. And now it's about the government taking action. So I called for a national maternity improvement strategy.
Right.
I was very surprised to see that there was not a standardised level of care in maternity in hospitals across the UK. And unfortunately, there's a real postcode lottery. So depending on where you live currently in this country, you will actually receive a different level of care on maternity. And I'm currently doing a podcast called Breaking the Taboo, launching in January. And we're still hearing from mothers. And I'm no longer chairing the inquiry, but almost on a daily basis, I am still receiving submissions from mothers sharing me their stories.
I don't want to make this a male-female thing, because, as you rightly say, patients feel that they're not listened to in lots of situations. Is there a bit of misogyny here? And also, on top of that, a little bit, especially from, as you, health professionals that might see a lot of births, see a lot of worried mums, the inability to sort of trust first and then take action first and then decide actually they didn't need to later, you know?
I think that's absolutely right. I think, first of all, we heard a lot of examples in the inquiry of mothers not being listened to. So, sadly, I'm afraid Chloe's story was not unique. I heard lots of similar stories where mothers were ringing up and saying, something's wrong with my baby, either phone wasn't being answered on the ward or notes weren't being handed over between shifts to know that the same mother had called the hospital repeatedly to say something was wrong with their baby. So I think this is about making sure that we invest the resources, but also having the right policies in place.
Going back to your experience, there you are, going through 2 hours of hell, basically. Yeah. Were you able to speak?
So I was obviously conscious the entire time I was on the operating table. And I think I'm so traumatised still, to be honest, now, from the birth. I mean, it was very clear to me when I gave that speech in the House of Commons, where I very personally talked about my experience.
Yes.
That was very powerful, because you don't see that, people sharing that emotion. Sorry, I interrupted you, but I can remember it. You cried, didn't you?
I did, which obviously as a politician is extremely rare to burst into tears in Parliament.
No, well, Theo, it's OK.
Yeah.
But I think it illustrates the point, right, that I thought I was OK, but really I'm not. And still even talking about it now, my daughter's over 2 years old, it still feels incredibly traumatising. And as you said, you know, when you're a first-time mother, we don't know what to expect. And when we think something's wrong and we ask for help, we expect to be listened to. And And I think we do need to have a frank discussion about the risks in childbirth, and we need to trust women to decide for themselves. So we talk to them a lot about C-sections, but we don't tell them about the other things that can go wrong. I had a birth injury. I didn't know anything about that before I suffered my own due to a vaginal delivery. And I think we need to trust the public and to tell them what's going on.
You say, Chloe, that subsequently they basically said, yes, she was right. Yeah, she was absolutely right. Did anyone ever come up to you and say sorry?
Not in a legal setting, no. We had a apology from a consultant prior to taking legal action.
OK.
At the moment, we're yet to have a genuine apology from the hospital, apart from when I've done media and they have issued an apology in the media.
Well, look, we've got some statements here for relevant people to share. A Department of Health and Social Care spokesman said, patient safety is paramount. Everyone deserves a safe, high-quality care. We'll never turn a blind eye to failure, and we'll work to root out poor performance and restore public confidence in the health service. And also a spokesperson for NHS England has said that NHS staff are working exceptionally hard to deliver safe patient care. We're focused on ensuring every part of the health service is working together to manage demand and prioritise patients with the most urgent needs. We know there is still much more to do to ensure everyone receives high-quality, personalised care across the NHS. I mean, you quoted, Theo, an instance where the person said, not my baby, not my problem. I mean, that sounds pretty unforgivable. But for the most part, you sense that people are perhaps trying their best. So what can be done and what's going wrong? Is it more resources, more time, or is it something different?
So I think it's partly about money. And I think, to be fair to the previous government, they did announce £35 million of extra funding in the budget in the spring. But I think it's also about the culture in the NHS. So some of the stories that I read were about things like not being brought a glass of water after labour, being told to go and get food from the canteen when you've had a C-section, you can't walk. I mean, these are things that don't require additional funding, right? They're about language, they're about listening. Exactly.
Human charity.
Exactly.
All right, both of you, thank you so much for coming in and being brave enough to go through that. I mean, dear God, what extraordinary accounts.
Indeed, and I'm sure, unfortunately, are still going to get flooded with more cases, so
well, look,
keep the conversation going.
If you've been through something like this, anything similar, then you can find advice and support at itv.com/helplines.